In 1967, three Harvard scientists published a review in the New England Journal of Medicine. The review concluded that dietary fat was the primary driver of heart disease. It recommended reducing fat consumption, and it said almost nothing about sugar. For the next 5 decades, that conclusion shaped nutritional policy worldwide. Governments advised people to eat less fat. The food industry produced low-fat products. Dietary fat became the villain of public health. Heart disease rates did not meaningfully decline. In 2016, a researcher examining historical documents from the sugar industry found the internal correspondence that funded that 1967 Harvard review. The Sugar Research Foundation had paid the equivalent of $50,000 in today's money to 3 Harvard scientists to produce a literature review that minimized sugar's role in heart disease and emphasized fat's role instead. And here's what you probably don't know. One of the scientists who accepted that payment later became the head of nutrition at the United States Department of Agriculture. He helped shape American dietary guidelines for years. To understand why this matters, you need to know what was happening in nutrition science in the early 1960s. There were 2 competing theories about the primary dietary driver of heart disease. The first, championed by a physiologist named Ansel Keys, argued that saturated fat raised cholesterol and caused heart disease. The second, championed by a British physiologist named John Yudkin, argued that sugar was the primary driver. Both theories had supporting evidence. The scientific debate was genuine and unresolved. Yudkin published his research throughout the 1960s. In 1972, he published a book called Pure, White, and Deadly, arguing that sugar was the primary driver of heart disease, obesity, and diabetes. The sugar industry's response to Yudkin was not to engage with his science. It was to destroy his reputation. In 2016, a researcher named Kristen Kearns published a paper based on internal Sugar Research Foundation documents she'd found in university archives. And what those documents revealed should change how you think about the food you eat. In 1964, the Sugar Research Foundation, the lobbying arm of the American sugar industry, identified scientific concern about sugar's role in heart disease as an existential threat to the industry. They developed a strategy specifically designed to shift focus away from sugar and toward fat. They identified and approached 3 Harvard researchers. They paid them to conduct a literature review that would reach conclusions favorable to sugar. The researchers did not disclose the funding in their published paper. Journal disclosure requirements didn't mandate that in 1967. And here's the consequence of that decision. The 1967 Harvard Review was published in the New England Journal of Medicine, one of the most prestigious medical journals in the world. Its conclusion that fat caused heart disease and sugar did not was cited in research and policy documents for decades. It shaped government dietary guidelines in the United States and internationally. It shaped what food manufacturers produced. It shaped what doctors told patients. When food manufacturers removed fat from products, they replaced it with sugar to maintain palatability. A low-fat yogurt typically contains more sugar than a standard yogurt. The population reduced fat consumption as advised. Sugar consumption increased substantially. Obesity rates, which had been relatively stable for decades, began rising sharply in the 1980s. Now, let's talk about what happened to the man who was right all along. John Yudkin's reputation was systematically attacked by the sugar industry throughout the 1970s. The foundation funded responses to his work, characterizing his research as a mountain of nonsense. Ansel Keys, whose fat hypothesis served the industry's interests, described Yudkin's work as discredited in published papers. By the late 1970s, Yudkin's reputation had been sufficiently damaged that his work was largely dismissed. He died in 1995, largely discredited within mainstream nutrition science. And what you need to know is that subsequent research has substantially validated everything he argued. A 2010 meta-analysis examining data from 347,747 subjects found no significant association between saturated fat consumption and cardiovascular disease. The fat hypothesis, the one the sugar industry paid to amplify, did not hold up. And if you're thinking this was a one-off, it wasn't. The sugar industry's funding of nutritional research didn't end in 1967. A 2013 systematic review found that studies funded by the beverage industry were 5 times more likely to find no link between sugar-sweetened beverages and obesity than independently funded studies. Coca-Cola was found in 2015 to have funded a research organization that promoted the argument that physical inactivity rather than diet was the primary driver of obesity. Internal documents revealed Coca-Cola had significant influence over that organization's research agenda. It disbanded following media exposure. The same strategic playbook, fund research, shape conclusions, discredit critics, has been documented in tobacco, lead paint, PFAS, and opioid industries. In each case, the goal is identical: create enough scientific uncertainty to delay regulation. John Yudkin was right. The science has since confirmed what he argued in 1972. He died having watched his life's work dismissed and buried, not because it was wrong, but because it was inconvenient. The Harvard scientists who accepted $50,000 from the sugar industry published their review without disclosing the funding. One of them went on to shape American dietary guidelines. The low-fat era they helped create lasted 5 decades. During those 5 decades, the population followed the advice. The obesity rate tripled. The sugar industry recorded record revenues.